There is a clause in the state of Missouri called Medicaid 1619B. Medicaid 1619B states that any person on federal disability who begins earning a wage that would cause them to lose disability payments can still maintain their Medicaid for up to a much higher wage. I believe in the state of Missouri it's roughly around $35,000 a year. The reason that is in place is because if people don't have health insurance, it will impact their ability to work. That is just a flat statement. There's really not a lot of arguing around it. You can't go to work if you're sick. You can't go to work if you have unchecked mental health issues. And Medicaid allows those things to be managed and keep Missourians working.
What do you think, Tom?
Yeah, James brings up a good point. It's an ongoing argument. The Republicans are opposed to the expansion of Medicaid and the Affordable Care Act on a strictly and totally political basis. They don't like it because it's a Democratic program, and the President Obama is the one that passed this. In the meantime, they fail to remember that the Obamacare, as we call it, was originally Romney Care, and the state of Massachusetts succeeded very well with it. They're doing fine with it. And Obamacare is patterned after Mitt Romney's plan. It worked in Massachusetts, and it's working in the United States, regardless of what they say.
Nice.
And 20 million people that didn't have insurance now have it. 20 million people that couldn't get insurance at any price now have health insurance and dental insurance.
So what does that mean for the 44th?
The exact number of jobs that it would bring would be hard to estimate, but we are in in Columbia, Boone County is a center for healthcare. We've got more hospital beds in Columbia per capita than any place else in the state. Anything that does with healthcare, anything that has an impact on getting people insured and getting people healthcare is going to have an impact here. It will bring jobs to Central Missouri.
Awesome.
Can I speak on that as well?
Yeah.
In the state right now, in order to apply for Medicaid, you are required by law to also file for disability. I can tell you point blank, there are people who do not need disability, who need Medicaid to help themselves start working, get those initial healthcare issues checked and covered, and they will work. They want to work. But we bog them down with unnecessary paperwork. And why? Exactly what Tom said, because we don't want to accept a program that was tied in any way to President Obama, and that's just ridiculous. We're bogging our most vulnerable citizens down with unnecessary paperwork because we don't want to work with the president.
Nice. And there's no while people quote a variety of different reasons why it's fiscally irresponsible to do this, the truth of the matter is the state of Missouri is $6 billion below what it should be, thanks for the Republicans not expanding Medicaid. Now, I'm not sure that $6 billion would solve all of our problems, but I'm pretty sure it would solve a lot of them.
Yeah, it'd be nice.